Gentlemen, if you are in your 50s, 60s, or even 70s, and you have noticed that your intimate moments feel different, especially if you experience the full sensation of pleasure and that peak moment of climax, but without the expected presence of seminal fluid, then this message is essential. Maybe it happened only once and immediately put a knot of worry in your stomach. Or maybe it has become a quiet issue you are keeping to yourself and you feel embarrassed and fearful about your health. I am Dr. Julia Hart, your trusted men's health advisor, with 10 years of experience focused on the most important areas of male health at every stage of life. Today, I want to have a serious but deeply supportive conversation with you. First and most importantly, I want you to know that I understand your concern. The change you are noticing in your body is not a sign that your masculinity has expired or that your intimate life is over. Think of it this way. It is not a failure. It is a detailed message your body is sending you, and that message simply needs to be decoded. Let us quickly review how this process normally works. Think of your reproductive system like a perfectly timed orchestra. The testicles produce sperm. The seminal vesicles contribute most of the nutrient-rich fluid, and the prostate adds protective fluid. This final mixture is collected and prepared within the urethra. When climax occurs, specific muscles contract in a powerful rhythmic sequence to propel that fluid mixture forward and out. It is a rapid event, the result of precise synchronization between nerves, glands, and muscles. Now, here is an important distinction, gentlemen. Orgasm and ejaculation are not the same. Orgasm is the neurologic sensation of intense pleasure governed by your brain and nervous system. Ejaculation is the physical act of expelling fluid. For most of your life, they occur seamlessly as a single event, but they are driven by distinct mechanisms. Our focus today is dry ejaculation. This is the technical term for when a man reaches orgasm, feels that characteristic pleasure, but notices little or no fluid is released. It is often described to me in my office as an empty orgasm. This gap between expectation and reality triggers anxiety, and I understand that. You have always expected a physical sign of the event, but it is important to understand that your ability to feel pleasure may still be fully intact, governed by your nerves and brain. The change is in the mechanical delivery system. This does not mean you have lost your authenticity. It simply means that one part of your body's plumbing has a specific, identifiable reason for the change. A quick pause before we count down the main causes. Stay with me, because in the next few minutes we will explore the 3 most surprising causes, the critical warning signs, and most importantly, the clear, manageable solutions that modern medicine offers to restore your peace of mind, confidence, and overall well-being. Before we begin, please press the like button, leave a comment telling me where you are watching from, and subscribe so you never miss important health information designed specifically for men over 50. Now, let me share what you need to know. Now, let us break down the 3 most common causes of dry ejaculation. Understanding the reason is the first step toward regaining a sense of control. The first cause is an overly relaxed gatekeeper, known as retrograde ejaculation. From a biological perspective, imagine a small muscular valve acting as a gatekeeper at the opening of your bladder. During climax, this valve is supposed to clamp shut firmly, ensuring that seminal fluid has only one path to travel, forward and out. If this valve is too relaxed, the fluid follows the path of least resistance and flows backward into the bladder. You still feel the full pleasure of orgasm, but because the fluid does not exit the body, the experience feels dry. One common and usually harmless sign is noticing that your urine appears cloudier shortly after intimacy because the seminal fluid has mixed with it. This phenomenon often occurs after prostate or bladder surgery. These procedures are successful and often necessary, but they can affect the nerves that finally control the opening and closing of this valve. It is also a very common side effect of certain medications used to treat chronic conditions such as high blood pressure or an enlarged prostate. These drugs act on blood vessels, but they can also relax the small muscle that controls this valve. I recall a patient who was deeply distressed after an otherwise successful surgery. Once he understood that this was simply a mechanical change, similar to a traffic light being stuck in the open position, and that his desire and ability to feel pleasure were completely unaffected, he felt enormous relief. The key point is that this is a mechanical change, not a loss of vitality. The second cause involves blocked plumbing, specifically obstruction of the ducts. The second major cause is a blockage in the ducts through which semen travels. From a biological standpoint, the seminal vesicles and other glands are producing fluid normally. But think of the small ducts as distribution pipelines. If those pipelines are blocked, the delivery vehicles cannot get through. The volume of fluid is greatly reduced or disappears entirely, even though production is normal. In practical terms, these blockages can be caused by scarring left behind from past infections, such as severe untreated prostatitis. In rare cases, small calcifications like tiny stones can form and block the passage. The warning symptoms may be subtle, but some men report a new mild discomfort in the pelvic area during climax, or they may notice that the fluid has gradually become thicker and less abundant over a long period of time. The good news is that many of these blockages can be cleared with medication to control inflammation or, if necessary, minimally invasive procedures to restore normal flow. The third cause is low hormonal fuel. The third major area to investigate involves hormonal factors, especially low testosterone. Biologically, testosterone is the primary fuel for the male reproductive system. It does not only regulate libido and sperm production, it is also essential for optimal function of the prostate and seminal vesicles, which contribute most of the fluid. When testosterone levels drop significantly, the entire system slows down. Emotionally, you may initially notice a decrease in fluid volume. Over time, this deficiency can also present as reduced sexual desire, less reliable erections, and a generally less intense orgasmic sensation. More broadly, men often experience fatigue, mood changes, and loss of muscle mass. If this information is new to you, please press the like button. Next, we will move into the solutions. From a practical standpoint, this condition is often called hypogonadism, a hormone deficiency that is treatable. If a simple blood test confirms a deficiency, carefully managed hormone replacement therapy can often restore not only better fluid production, but also energy, desire, and overall quality of life. It is incorrect to dismiss this as simply aging. While most of the time these causes are manageable, as your physician I must also address important exceptions. Dry ejaculation can sometimes be a warning sign of a more serious condition, which is why paying attention to accompanying symptoms is critical. When should you see me immediately? If dry ejaculation appears suddenly without explanation, especially if it is accompanied by pain, blood in the urine or fluid, fever, or loss of sensation in the genital area, do not wait. These are signals that require urgent urologic evaluation. Certain neurological conditions, such as Parkinson's disease, long-standing, poorly controlled diabetes, or in rare cases, specific urologic cancers can interfere with the mechanical pathways or the nerve signaling involved. The emotional impact is very real. Beyond the physical aspect, we cannot ignore the profound psychological toll this can take. Many men equate the presence of fluid with performance and with their sense of authenticity. When it disappears, feelings of loss, anxiety, and frustration can take hold. Men often begin to avoid intimacy out of fear of being judged or feeling incomplete. Emotional reassurance is essential. The most important step in breaking this cycle is information and communication. Understanding that this is a physiological change and not a personal failure can lift an enormous burden. Your ability to feel pleasure, to achieve erections, and to enjoy connection does not depend solely on the presence of fluid. Your intimate life can and should remain a source of joy. To conclude, I want to leave you with a clear and supportive action plan so you can regain a sense of control. There are 3 decisive steps you should take immediately. First, do not ignore it and investigate it. The sudden appearance or gradual progression of dry ejaculation warrants a visit to a urologist. A simple medical history, a physical examination, and often basic blood or urine tests are all that is needed to reach a clear diagnosis. A diagnosis brings relief. Second, control underlying conditions. Maintain good control of chronic diseases such as diabetes, high blood pressure, and high cholesterol. These conditions directly affect vascular and nerve health, which govern the entire sexual response process. Proper management of diabetes, for example, can prevent further nerve damage from continuing to affect the bladder valve mechanism. Third, break the silence. Speak openly with your partner and with your doctor. Sharing what you are experiencing is freeing and opens the door to solutions. Remember that professional support, whether through medication adjustments or a targeted treatment plan, is the most effective tool for restoring your confidence. Timely action can completely change your experience and restore the sense of safety and intimate connection you deserve. Gentlemen, the absence of seminal fluid is not the end of your intimate life, nor a verdict on your masculinity. It is a signal from your body that deserves to be heard and evaluated with the help of a professional. Understanding the cause, whether mechanical, obstructive, or hormonal, is the first step toward regaining peace of mind. I have witnessed countless men restore their confidence, vitality, and joy in life after receiving a clear diagnosis and a concrete plan of action. Your vitality is not measured in milliliters of fluid, but in your overall health, well-being, and ability to live fully and connect deeply. Do not let doubt or shame prevent you from seeking answers. Acting promptly can completely transform your experience and restore the security and intimate connection you fully deserve. Your best years are still ahead of you. Be proactive, be confident, and value yourself. This information truly has the power to change someone's perspective. Please press the like button to help this message reach more men, and subscribe to the channel and enable notifications so you do not miss our upcoming content on male vitality health. I am Dr. Julia Hart.